Hello and welcome to Triage, rapid legal lessons for busy healthcare professionals, a podcast created and produced by K&L Gates. Each episode is designed to highlight important developments in health law and analyze the impact on our clients and friends of the firm. We hope you enjoy this podcast.
Hello, this is Stephen Bittinger, and I am a healthcare partner with K&L Gates. My practice focuses exclusively on reimbursement and some of the disputes that surround healthcare reimbursement. I'm a part of the payer-provider litigation collaborative that operates nationally and also around the world. Thank you for taking a few minutes to listen to this episode of Triage. I want to talk about the CMS announcement on October 9th that 171 cease and desist letters had been sent to facilities, did not have proper CLIA certifications. Interesting, about 34% had no CLIA certification, which may be facilities that just did not have the proper applications completed and should not have been completed that type of certification and should not have been performing that kind of testing. However, 66% of those facilities had a CLIA certification, but it was too limited. So it is important to understand that in the middle of this pandemic, where testing for COVID is absolutely vital, that you've got to really drill down. So in CMS's announcement, it's important to understand that every facility that conducts COVID testing is considered to be a laboratory for CLIA purposes. And this is important because it's about public safety, right? That CMS wants to make sure that they're preventing false results, either positive or negative. And these cease and desist letters do have some teeth to them. All right. These different facilities were told to immediately stop or face potential civil monetary penalties of $23,000 per noncompliance or day. And they were also, however, given direction on how to gain proper CLIA certification. Just a couple weeks before this announcement, on September 25th, 2020, CMS released a quick start guide to help laboratories become CLIA certified or to expand their CLIA certification to include COVID testing. The CMS CLIA program website, there's an official website now, includes a lot of really wonderful resources, online payments, direction to state agencies that can assist. It is also important to understand that despite all of CMS's efforts to try and deal with the dramatic acceleration of this type of testing, lots of circumstances fall through the cracks, and lots of square pegs do not fit in round holes. One of those I want to talk with you today about is a unique circumstance in Blaine County, Idaho. In Blaine County, Idaho, a group of providers found that their area was a hotspot for COVID and that there was no high complexity lab within a reasonable distance of Blaine County. So they actually applied for and received an institutional review board approval for a clinical trial. And this clinical trial and research project was for testing for antibodies for COVID. They received a cease and desist letter. This happened earlier this year, and there is a kind of a standoff. You can read about it in the news between the COVID response group in Blaine County, Idaho, and CMS. The group believes that they're operating appropriately under their IRB approval. CMS does not. It'll be interesting to watch how that plays out. However, the cease and desist letters raise a lot of significant reimbursement questions, right? So the main questions are, how does the public health emergency affect this circumstance? Obviously, the 1135 waivers, which is a relaxation of regulations underneath a public health emergency, allowed for a lot of unusual circumstances earlier this year, including emergency use authorizations, or EUAs, that were approved by the FDA to allow for these type of tests to come out more quickly. And so the bottom line is that there's just not clear answers for a lot of these complicated questions, particularly with testing and what facilities, because the whole process and the testing methodology is evolving so quickly. So despite the fact that CMS has got a frequently asked questions that is updated as of September 11th, 2020. It's 145 pages, and it still doesn't answer all your questions. So how is this going to play out for claims that have been paid? Now, it's important to understand that CLIA certification is normally a mandatory condition of payment for these types of tests with CMS. But then the question also becomes, how many of these claims that have been paid for private payers, which normally also require CLIA certification, or that a facility or laboratory meets all of the CMS standards for performance of these tests? When you have all these claims that have been paid and all of a sudden CMS determines that you are outside of your scope or not properly certified under CLIA, there's going to be a significant dispute over whether you were paid properly or not. And it is going to be interesting to be involved in and watch a lot of the resolutions for the payments that have already gone through for COVID testing. So thank you very much for taking a few minutes to stay current in this very complicated, evolving time in healthcare. If you have any questions, please feel free to reach out.
Thanks again for listening to Triage, rapid legal lessons for busy healthcare professionals. New episodes are available for download through iTunes, Google Play, and other podcast applications. By subscribing to Triage, you will receive timely notifications of each new episode. Also, if you have any topics that you would like to hear discussed on Triage, please don't hesitate to email triagesupport@klgates.com. We would love to hear from you.